Hello, and welcome to part 2 of humerus and shoulder girdle anatomy. Let's begin part 2 by discussing the scapula. So the scapula, or the shoulder blade in layman's terms, which forms the posterior part of the shoulder girdle, remember, is a flat, triangular bone with 3 different borders, 3 different angles, and 2 surfaces. I'd also like to add it has 3 fossas. So there's a lot to know on this little bone. So let's start with the borders. The 3 borders are the medial or vertebral border, and we call it vertebral because of its close proximity to the spine. The second border is the superior border here at the top of the scapula. And last is the axillary or lateral border. And remember, axillary refers to armpit, so it's the border closest to the armpit or the axilla. All right, let's take a look at the anterior aspect of the scapula. The 3 corners of the triangular-shaped bone are called angles. The lateral angle, you can see here, is sometimes called the head of the scapula. It's the thickest part of the scapula, and it ends laterally in this shallow depression called the glenoid cavity or glenoid fossa. The humeral head actually articulates here at the glenoid cavity to form the scapulohumeral joint, or you might hear it referred to as the glenohumeral joint. Those are just fancy names for shoulder joint. Okay, so the constricted area between the head and the body of the scapula is called the neck. You can see that here. The superior and inferior angles refer to the upper and lower ends of the medial or vertebral border. So let's say that again. The superior and inferior angles refer to the upper and lower margins of this vertebral or medial border. The body of the scapula is kind of arched, and you can see that when you hold one of the bones in lab. And the purpose of the arch is really to provide greater strength to that bone. The thin, flat lower part of the body is sometimes referred to as the wing or the ala of the scapula, but Bontrager notes that those are not the preferred anatomic terms, so we'll call it the body. The anterior surface of the scapula is termed the costal surface because of its proximity to the ribs. Remember, costa meaning ribs. This surface articulates with the rib cage. The middle area of the costal surface presents a large concavity or depression known as the subscapular fossa. And remember, there's a depression there because of the arched shape of the scapula. So on the costal surface, this depression is called the subscapular fossa. Next, the acromion. The acromion is a long curved process that extends laterally over the head of the humerus. So picture the head of the humerus here. The acromion sticks out laterally over the head of the humerus. We think of the acromion as a posterior structure. The coracoid, right here, is a thick beak-like process that projects anteriorly, and it's actually beneath the clavicle. So, acromion is posterior, coracoid is anterior. And notice it's spelled different than coronoid in the elbow. Coronoid in the elbow is C-O-R-O, and then noid, so it's just a slight spelling difference just to be aware of. All right, next, the scapular notch is a notch on the superior border that is partially formed by the base of the coracoid process. Okay, so scapular notch is partially formed by the base of the coracoid process. Okay, good. Let's take a look at the posterior aspect of a scapula. The prominent structure that we see on the dorsal or posterior surface of the scapula is called the spine. And that's what you see here. So this elevated spine actually starts at the vertebral border as a smooth triangular area, and it continues laterally all the way to the end here at the acromion. So the acromion is the end of the spine. Okay, and remember that acromion overhangs the humeral head and the shoulder joint posteriorly. The posterior border or ridge of the spine is kind of thick. It's a thickened structure, and so it's called the crest of the spine. And the spine actually separates the posterior surface of the scapula into two different fossas, the infraspinous fossa and the supraspinous fossa. And both fossa, or fossae for plural, serve as attachment points for shoulder muscles. So when I am trying to remember the three fossas of the scapula, I look at the word supraspinous. It's got to be above the spine, infraspinous below. Okay. All right, next let's look at a lateral view of the scapula. The lateral view of the scapula really helps us visualize the various anatomical structures of the scapula. And notice it looks like a Y. That's why we call it the Y projection. The upper parts of the Y are going to be the acromion posteriorly and the coracoid process anteriorly. And remember, again, the acromion is the expanded distal end of the spine, which you see here. D is the spine. And remember, the acromion extends superiorly and posteriorly all the way to the glenoid cavity. The coracoid process is located more anteriorly, remember, in relationship to the glenoid cavity. So let me point out the glenoid for you. Do you see this kind of circular structure right here? You can kind of see the bottom of it here. That is the glenoid cavity. Okay, so we'll talk about that more in lab. The lower portion of the Y is the body of the scapula. So remember, the posterior surface or the back portion of that thin body is called the dorsal surface. Okay, and then the anterior surface of the body is the ventral or costal surface. The lateral or axillary border, remember, is a thicker edge, and it extends all the way from the glenoid cavity here down to the inferior angle. Okay. Again, it's really important that you're able to identify anatomy in a Y, and we'll certainly look at this more in lab. The AP scapula. So this slide depicts an AP scapula radiograph. Notice the model here, how she has her arm abducted. The purpose of abducting the arm is to draw the scapula away from the thorax as much as possible. Kind of bring it away from that rib cage as much as we can. So let's identify the parts. A here is going to be the acromion. B is the region of the neck of the scapula. C is going to be the region of that scapular notch. Remember, it's the base of the coracoid. D is the superior angle right here. E is the medial or vertebral border. F is the inferior angle. G is the lateral border. And H is that region of the glenoid cavity or the glenoid fossa. Another word for that would be the scapulohumeral joint or the shoulder joint. Here we have another Y projection. And notice how the patient is positioned in a left anterior oblique here. The goal of this projection is to turn the patient until the scapula is visualized on end or lateral. And it's really nice if we can separate it from the rib cage, again, just to make it more visible. Remember, the acromion and the coracoid are the top of the Y, and the body makes up the long lower portion. So let's identify the parts again. So A, remember this is part of the Y, the top of the Y rather. This is the acromion. B is the coracoid process seen here. C is the inferior angle. D is the spine of the scapula. And E is the body or the dorsal surface of the scapula. So when you are performing a lateral scapula, you can do it PA and do an anterior oblique, as this patient is seen here, or you can do it AP and do a posterior oblique. And we'll talk about that more in lab. Okay, we're going to conclude part 2 here. We will pick up part 3 with the inferior superior axial projection.